Hi, my name is Jane from Preferred Care at Home. I'm going to talk to you about something that I bet every one of you knows someone that is struggling with dementia. A relative, a friend, someone that you are close to, that you have experienced or are experiencing how to care for a loved one at home. And just going to give you some practical tips of what I observed works. I've been a nurse for 30 plus years, and currently now I hire caregivers for the home and mentor family and the caregivers how best to handle situations so your loved one can remain independently at home as long as possible and very doable until the end of life. One of the biggest things I observe is the family coming in and really coaxing, whether it be mom or dad, to say their name. It's almost to the point where if the person with dementia cannot say their name, they're going to leave. And then it increases the person's agitation because that part of their brain isn't working like it used to. So consider that it is possible, and notice that if you introduce yourself like I would as a nurse, say, good morning or good afternoon, my name is Jane, and identify who I am, that it does relieve so much stress, and the focus doesn't become then a question of how they are doing by whether they can say your name or not. I do sense, and with experience in my own family with living with someone with dementia, that a person doesn't forget your essence or who you are, the familiarity. Yes, they do forget your name. And I've often heard that as a reason for not going to visit your loved one, because they don't know who I am anyway. I know as a nurse from repeated visits that they do recognize me from visit to visit, and I'm newer in their life. So there's something about your calmness, your familiarity, and not pushing to get information they can't produce. It's kind of like when you were in school and you weren't paying attention and the teacher called on you, no clue what the answer was. That awkward, embarrassing, where you can't produce what is desired from the other party. So that's just something that seems to really make a difference in visits from family members. And then another option is also to have a photo album of picture of yourself at the age your loved one started with signs of dementia. And then if it's been some years, have a current picture next to it with your name and your relationship. So even when you're not there, whether it be a family caregiver or a hired caregiver, it's something they can look at, be reminded of, and when you come, you can introduce yourself and point out who you are in the family. It's just much less stressful, and they aren't able to formulate the word and say your name, and it's not about you, and it's often made that way. It makes it for a very stressful experience, increasing your loved one's agitation, often meaning increasing also medications to control it. So there's just a few ideas of things that you can consider in making it easier to handle your loved one at home. Also, very commonly, people talk about sundowning. Sundowning happens as it starts getting dark. Things they normally wouldn't be frustrated with become easily frustrated. Language you may have never heard from your parent often is said at sundowning time. And when whoever's taking care of your loved one, if they get agitated and upset and try to control the person, it can make sundowning escalate, especially if they're trying to get them to eat foods they don't like normally for their health, or bathing often becomes a conflict in the evening before bedtime. It's a time where not reacting so to a change in the person, because they're uninhibited part of the process that changes in the brain is in the frontal lobe. So as a result, seeing behaviors and hearing words that are not normal at all for your family member or your friend. So it becomes embarrassing, but when you realize it is part of their brain and call it that, it becomes easier to recognize it, and when you're not controlling and calm and how you handle it, using humor often de-escalates. Distraction with some type of creative art, because that part of their brain has more room to explore their creativity when they're not using it now for complex language. So that is something that is very soothing for them. Listening to music, whatever music they enjoyed in their younger years, is very calming for them now in the evening. And if your family member is able to go for a walk, getting outside in the fresh air often is very good for them to help them to calm themselves. I make unscheduled visits with my clients when a caregiver is in the home, and that is for your safety of your loved one, and also to make sure they are doing what you have hired them to do. And then it also gives me an opportunity to mentor and educate whoever is present in the home. So if this sounds like something you would enjoy a home visit to assist you with your loved one, you can call me in my office at 661-977-5007, and I do free evaluations. And it's something that if you're a family caregiver, you know what I'm saying when it can be exhausting. And sometimes just having 4 hours off one evening when it's the hardest part of the day typically can make a huge difference in your life. Something to think about. And for me, it is easy to see inside and realize that the person before the dementia changed their brain, who they were like, and visit with them on that level. And they show emotional response. So it is something that you often see family caregivers, paid caregivers, treating the person different just because they can't respond verbally or respond with appropriate words. But inside, they need respect. They need to be treated. If they worked as a professor, they need to be treated as a professor, because that's the last thing they remember before the changes in their brain. So it is so important for them. Thank you for your time.